Good afternoon, everyone. Welcome to the Hidalgo County Wellness Program 2021 Virtual Wellness Fair. My name is Diana Hualpa with the Hidalgo County Wellness Program, and I'm very glad that you joined us today. Before we get started, we want to make sure that the technology is working for us today. So if you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is located on the bottom of our Zoom webinar software. Again, if you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is part of our Zoom webinar software. And thank you so much for everybody that is participating on raising their hand through the software. We do appreciate that. It looks like we're good to go technology-wise. I do have a couple of reminders before we get started. Reminder number one is that we still have 7 additional presentations as part of our 2021 Virtual Wellness Fair. Therefore, if you haven't set up a reminder for those presentations or any of our upcoming webinars, I do invite you to do so through the Hidalgo County Wellness Program Fair website or our Hidalgo County Wellness Program website. We do have some webinars on demand as well, so feel free to watch those whenever you have some time. And the second reminder is that you are on listening only mode. However, you are able to submit your questions via our Q&A forum on our Zoom webinar software throughout the presentation, and we will answer them during our Q&A session at the end of the presentation. At this point, I have the pleasure of introducing our guest speaker for today's presentation, Dr. Cesar Uribe. Dr. Cesar Uribe is a practicing hospitalist with H&I Healthcare at Rio Grande Regional Hospital. He attended medical school in Veracruz, Mexico, and traveled to Houston, Texas for a research postdoctoral fellowship in cardiovascular science and heart failure. Dr. Uribe completed his internal medicine residency at Valley Baptist Medical Center in Harlingen, Texas in 2018. And he currently is working in Rio Grande Regional Hospital in McAllen, Texas, providing evidence-based medicine to help patients understand their disease and apply preventative measures. Dr. Uribe, thank you so much for joining us today. This is actually a very exciting presentation because it's the first one that we co-host with Rio Grande Regional Hospital. So I'm extremely happy that you are here with us, Dr. Uribe.
Yeah, I'm very excited to help you understand more a little bit of this very common disease. If you have any questions during my presentation, feel free to just send your questions my way.
Thank you so much. And the presentation looks perfect.
Can everyone see the screen?
Yes, everything looks perfect.
All right, well, let's start then. So hyperlipidemia, that's the medical term for high levels of lipids or cholesterol, which are fats that we all have circulating in the blood. Those include, or maybe you're familiar to the term cholesterol or triglycerides. We'll go more through the details and the names, just so you're more familiar with what this means. So what's cholesterol? It's like a waxy fat-like substance that it's found in all the cells in your body. All the cells need these to create the membranes in your cells. Also, they're needed to make hormones, vitamin D, and some other substances like enzymes that will help you digest anything that you put in your stomach, any type of food. Your body will create all the cholesterol that it needs, but also will absorb cholesterol that you ingest in your diet. So it's important to see what you are having for a diet or what type of food you're ingesting to help you prevent developing this disease. So why is high cholesterol important? High cholesterol level, also called hypercholesterolemia, can increase your risk of developing chest pain, heart attacks, strokes, that I believe we're all familiar with these types of entities. These plus other common diseases like diabetes, high blood pressure will put your risk of developing any of these cardiovascular problems at a very high level. If you have high cholesterol, you might have a higher risk for heart attacks, strokes, and other medical problems that people with normal cholesterol levels will not have. The higher your cholesterol is, the higher the risk that you have to develop these problems. So there's several types of cholesterol. The more commonly measured in a blood level or in a test that usually a doctor will order for a patient are the total cholesterol, the HDL or high density lipoprotein, LDL or low density lipoprotein, and the triglycerides. So the cholesterol total, it's the sum of all the types of cholesterol, including intermittent density, very low density, high density, low density. And this number, once it reaches certain level, especially above 200, it will start increasing your risk for cardiovascular problems, heart attacks, strokes, you name it. The treatment for elevated total cholesterol will be depending on the levels of the LDL or bad cholesterol, and also the HDL or good cholesterol. And we'll go through some of the details of why these are called like that. So HDL cholesterol, called good cholesterol. I'm pretty sure some of you are going to be familiar with this term. These type of cholesterol, the higher the number, it's the better outcomes that you can have, or your chances to have a stroke or a heart attack will be less. Opposite from the low density cholesterol or bad cholesterol, which the higher the number, the higher your chance to developing atherosclerosis, which is calcification or cholesterol deposits in the arteries that will lead you to have high blood pressure, to have strokes, to have heart attacks, to have a peripheral artery disease, which is also another common problem that will affect the circulation in the legs. And triglycerides are not cholesterols per se, but they are reported in the lipid panel that your doctor will ask for certain patients. And it's also linked to cardiovascular disease and other types of problems with pancreas or digestive problems. So your cholesterol levels and the relationship with cardiovascular disease, you can see this is a pretty informative table from the cholesterol guidelines management from the American Heart Association. So as you can see, as a traffic light here, just to identify or make it easy for everybody, low heart or cardiovascular disease risk will be with a total cholesterol less than 200, an LDL cholesterol less than 130, and the HDL or the good cholesterol 60 or higher, as well as the triglycerides. If they're lower than 150, it'll be optimal. Patients that will have borderline risk for strokes or heart attacks will be with a total cholesterol of 200 to 239, LDL cholesterol of 130 to 160, and the good cholesterol between 50 and 59. And patients that will have definitely high risk for cardiovascular problems will be a total cholesterol of 240, LDL of 160 or higher, and an HDL cholesterol less than 50, which is a good cholesterol. And those are the type of patients that will most likely require medications. Other risk factors for these cardiovascular problems that are linked, or they're very commonly found on patients that have hypercholesterolemia or hyperlipidemia or increase in cholesterol levels, are cigarette smoking, high blood pressure, like I mentioned earlier, and having a family member, parent, sister, or brother who has heart disease at a younger age, which will be 55 or younger for men and 65 or younger for female. And a diet that is not heart healthy, which is defined, a heart healthy diet is defined a diet that includes a lot of fruits, vegetables, fiber, and healthy fats will be fats that are rich in those good cholesterols, which is commonly found on fish and certain other oils, like olive oil. And we'll explain a little bit more also after when we're in the therapy area. So cardiovascular disease happens when blood vessels get clogged with fatty deposits, meaning the cholesterol gets stuck to your arteries or veins, and that will restrict the blood flow that normally should happen. As you can see in the first image, this is what will cause a heart attack. That's an image of an artery that supplies blood to the heart, and when it gets clogged, the heart will stop receiving blood with oxygen, and that's when a heart attack happens. There's muscle damage and the rest of the stuff that will develop afterwards. Same for the stroke. You can see in the middle picture, there's a blocked artery that will obstruct the blood flow to the brain, and that's how those strokes, embolisms will happen. And in the peripheral circulation, as I was explaining earlier, same story, clogged artery, restricted blood flow, and then you'll get a narrowed artery. And those symptoms that you'll develop with that, it's similar to what a heart attack will be, but it will be a patient that is walking certain distances, so the blood flow is not going to your limbs, to your feet, and you start developing some pain there. So who needs lipid screening or cholesterol screening? There's a discrepancy in the guidelines, but most of them agree that men and female will be different, just because female require higher levels of cholesterol because of hormones and other substances that they require this cholesterol. So for men, regular lipid screening should start at age 35 if they don't have any risk factors for cardiovascular disease, regardless of if you're healthy or not. At 35, you should start getting those measured, just as a preventive measure. And screening should start at age 25 to 30 if there's other risk factors like obesity, diabetes, high blood pressure, smoking, or the family member relationship that we established before. For women, the lipid screening, just regular screening, should start at age 45 if there's no other risk factors for cardiovascular disease. And screening should start at the age of 30 to 35 years if they do have risk factors for these problems, same risk factors as obesity, diabetes, high blood pressure, smoking. So the first recommendation for patients that have moderate elevation of the cholesterol, or even the patients that do not have problems with cholesterol numbers, are lifestyle modifications. Mainly the diet, because like I mentioned at the beginning, your body will create all the cholesterol that it's needed, but you can add more with what you ingest. So if you increase your fruit or vegetable intake, that'll be helping your body decrease those levels. And also a variety of fruits and vegetables with every meal. Another recommendation, we consume at least half of all grains as whole grains, like whole wheat bread, brown rice, whole grain cereals, instead of having regular white bread, white rice, or refined or sweetened cereals. Also, certain meats will be more rich in cholesterol than others. So if you're planning on decreasing your levels of cholesterol, you should choose chicken or fish instead of red meat or pork. Also, cook with oils that contain different types of fats, like corn, olive oil, peanut oil will be healthier than the other regular oils that are more commonly used. Exercise also is a very important recommendation. The newest guidelines from the American College of Cardiology and the American Heart Association recommends that adults accumulate at least 150 minutes of moderate intensity physical activity per week, or at least 75 minutes of vigorous intensity activity per week. So that will reduce your risk of atherosclerosis, which was the deposit forming around the blood vessels that would occlude the blood flow. If a patient or if somebody is unable to meet this minimum physical activity recommendation, doing at least some of moderate or vigorous intensity activities is beneficial in reducing this cardiovascular risk. Another common thing that they point out, or they're trying to address more in recent years, is preventing the sedentary lifestyle, because they realize that adults in the United States spend an average of 7 hours or more just doing work from desks, sitting down, watching TV, playing video games, and all those things will increase your risk for these cardiovascular problems. So just summarizing everything, right? Exercise will be associated with larger cardiovascular benefits, preventing strokes, preventing heart attacks, and also will decrease your triglyceride levels and increase the good cholesterol levels. Even a small amount of exercise is better than no exercise at all. So whatever everybody can do, it'll be helpful. So medical therapies that are available, and probably some of you are very familiar with some of these names, at least the commercial names. But first, we need to identify who needs cholesterol lowering medications. It's a patient that already had a heart attack or a stroke, a patient that knows that has heart disease like heart failure, a patient that has diabetes, a patient that has this peripheral arterial disease or poor circulation, and patients that have aneurysm in the main artery that goes outside the heart going to the abdomen. So the cholesterol strategies are first avoiding red meat, butter, fried foods, cheese, all the good stuff. Also losing weight if the patient is overweight and being more active, like I said. But the main therapy that we have available, it's medication called statins. So these statins are the most commonly used drugs to lower your LDL or bad cholesterol, and it will also help you increase your good cholesterol. Those are names called atorvastatin, fluvastatin, lovastatin, pravastatin, and the common names maybe that are familiar. It's Lipitor, Pravachol, Crestor. Those medications, I'm sorry, will help you decrease the removal of cholesterol by the liver, decreasing the amount of your bad cholesterol as much as at 25 to 55%, and also will decrease your triglyceride levels. These are other medications not as commonly used. We mainly use these other types of medications, and I won't go through into detail with this, because the main reason that we'll use these medications, it's either if your triglycerides are very, very high, or if you're unable to tolerate the other medications. But there are several other options for patients that are allergic to the statins, or they're not tolerating them because they have side effects such as muscle pain, problems with your liver, patients that have already involvement of the liver with other medical problems. So the medication will be recommended for, not for everybody, obviously, but like I said earlier, the main change in your lifestyle would address more your cholesterol levels. So for patients that will be started on therapy, you need to identify if the patient has no risk or risks of having heart attacks or strokes, and that'll help you start with some of these lifestyle changes, and as well as your medications if your doctor is recommending some of them. So the goal of the therapy, aside from making you more active and change your diet, it's decrease your bad cholesterol level or LDL cholesterol, increase your HDL cholesterol, which will help you prevent heart attacks, strokes, and decrease your triglyceride levels. I think this is all I have. So if anybody has some questions right now,
Perfect, Dr. Uribe. Thank you so much for the presentation. I'm going to go ahead and share my screen just so we can go ahead and start the Q&A session. And I know that we have already questions coming in, so I'll go ahead and start asking those questions. So, Dr. Uribe, the first question that we have is, My mother has told me that if she ever gets a heart attack, to put turmeric underneath her tongue. Do you know how true this can be?
For those type of, I'll call them medications also because they'll have an effect in your body, right? The only problem with those is that there's no established research, so we don't know what type of effects will have, because these medications go through a process of measurements of blood levels, measurements of the impact that will have in other organs. I'm pretty sure that it will have an effect in your total cholesterol, but it will also be helpful, that turmeric, for what it's the information that is available to open up the blood vessels that supply the heart. So that's why they're recommended. So when you have those type of problems, to put it just as an emergency measure, but I will always recommend to just go to your emergency department and get that checked.
Absolutely, doctor. And the next question that we have is, I exercise and I have a good diet. Why do I still have high cholesterol?
That will be because there's certain other problems, right? There's an hereditary component that some patients will have, despite having a good diet, despite having exercise, they still have other problems that are very difficult to detect. So if you're having these issues with your cholesterol, you will probably need to start a medication, maybe for a few months, a couple of them, because you probably have a problem with the transport of the cholesterol from the gut to your body, that it's absorbing more or is not able to get rid of it.
Okay, thank you so much for answering that question. The next question that we have is, how often do you recommend to check for the cholesterol levels? And I guess for the cholesterol screening?
For the screening, it will depend. If you are just doing it at the age with no risk factors, that will be at least once a year. But if you were already diagnosed with high cholesterol problems, initially after the therapy started, I'll say the first month, the third month, and then 6 months after that.
Okay, thank you so much. And are there any supplements that will aid in lowering your cholesterol?
That's a great question. Yes, fish oil is one of them because it's rich in those good cholesterols. So it will help you lower your bad cholesterol, increase your good cholesterol. Um, that's mainly the one that we use, or the omega oils also. And I believe that those are available over the counter in every pharmacy. So that's a very good supplement.
Okay, perfect. Thank you so much for sharing that. And the next question that we have is, how long will a patient be on medication to control cholesterol?
It depends how fast it get controlled, and it depends if the risk factors are present or not. Because some of the times the patients need to be in these medications just for a few months, a couple of years, and then just measurement of the cholesterol levels afterwards, frequently, at least twice a year. But if you have risk factors like diabetes, if you already have a heart attack, then those patients are probably need to be on those medications for years, or um, maybe just long life, because they don't only decrease the amount of your cholesterol levels, they also help reducing the inflammation around the blood vessels. So that also, it's one of the benefits that these medications have.
Okay, thank you so much. And the next question that we have is, I'm a smoker. Does the amount I smoke affect my cholesterol levels?
Um, it won't necessarily increase your cholesterol. What it will do, it's make you more prone of developing those clogging areas in the arteries. So what that does, it's increase the inflammation around the cells that form the blood vessels. So the cholesterol will be easier to stick to that area. So if you're a smoker, it doesn't matter if it's only a couple of cigarettes or if it's 2 packs a day, you are at that risk of developing those problems.
Okay, thank you. And following up on the previous comment on the different supplements that they can take, there's a question that we got that it says, is it safe to take fish oil for a long time to assist to prevent cholesterol?
There is no long-term side effects of it, but everything that you put in your system, in your body, will have an impact, right? So I would recommend to take it, but measure your levels, because on the long term, you'll probably have an impact that we don't know, because there's not a lot of research available on patients that are in those type of supplements for years, especially if they don't need them. So if you start those supplements and your cholesterol numbers are excellent, then you might not even need to take them anymore.
Okay, perfect. And the next question that we have is, does stress cause high cholesterol?
Not necessarily, but it's linked to high cholesterol because stress can lead you to high blood pressure and stress eating. So when you have those problems, then you are at risk of increasing your levels of cholesterol, not so much of your body responding to absorption of more of these lipids.
So if I understand correctly, it's more like there's not a direct link. However, it does increase the probability to additional factors.
Correct.
Right. And the next question that we have is, are there natural products that could be used to help with cholesterol levels?
It'll be maybe just the diet modifiers, like I said, the fruits, vegetables, whole grains. All those things will prevent the lipids or the fats from being absorbed, and all those things will help you decrease your cholesterol levels. So I guess if I'll say something, it will be more veggies, more fruits, which are natural supplements, if you want to call it like that, or just change in your diet or lifestyle.
Okay. And are there any specific foods, fruits and vegetables, or?
Yeah, it'll be like whole wheat bread, the oils that you need to use whenever you're cooking, which will be olive oil or peanut oil, that are better than corn oil or the sunflower oil that are more commonly
Mhm.
used. Fruits, veggies, whole grains, and then the types of meat. Chicken and fish, it's better instead of red meats.
Okay. And we have kind of like two questions on the same topic. So one of them was, I was recent, I was recently prescribed, and I'm not sure if I'm pronouncing it correctly, but it's statins, and I'm a little concerned over the side effects of that.
Yes, that's one of the most common medications, right, that we spoke about, the
Mhm.
statins. So the side effects that you can have, it's muscle pain, and that it's uncommon, but we can find it often. That's because certain patients will have also an hereditary problem that they're what we call slow metabolizers of medications. So what that does, it'll build up a little bit of that medication that can damage a little bit the muscles, and also liver toxicity, which that's why it's important for a patient when it started on those medications to have a follow-up the first month, 3 months, and then 6 months after, so they can measure those liver numbers and the muscle proteins, so they can be aware if that patient that was starting the medications is not going to develop some of those symptoms.
Okay, great. Thank you so much. And we do have a lot of questions, and we do have time for three more questions. And the next question that we have is, there is a big push on TV about beets. Is there any benefit to these extracts?
I'm not too aware of that information. Like I said, some of those products, they don't go through a strict process of research. So what we have, it's mainly experience for certain peoples. I'm pretty sure it will have an impact, but it will be also something to measure in the future. Like if somebody's starting on those medications, if there'll be a side effect too, or if somebody's starting with those supplements, if there'll be side effects in the long term, or they will interact with other medications that you will require. So bottom line, I guess, if you're diagnosed with that high cholesterol and you want to start these bits, you need to probably just follow up with your doctor so they can measure everything else to make sure that it's not interacting with your medications.
Okay, thank you so much. And the next question that we have is kind of two questions in one. So the first one is, can cholesterol meds aggravate fatty liver problems? And are you able to take fish oils and prescription medication at the same time?
The cholesterol medication will not affect your or will not worsen your fatty liver. If something, it will help you a little bit, unless you develop that liver toxicity from the medications, which is a very minimum amount of the patients. And it's very common and very safe to use fish oil with other prescription medications.
Okay, thank you so much. And the next question that we have is, my dad has cholesterol and he had open heart surgery. I am 30 years old. Should I be getting screened for it?
It depends at what age was that surgery, but I believe it will be important to start screening already.
Perfect. And the last question, I guess we can just add one more that says, does it take for fresh fruit and veggies to have positive impact in lowering your cholesterol? And I guess we have discussed this about the healthy foods affecting the cholesterol, but I guess just if we can elaborate a little bit more on the fresh fruits and vegetables.
Yeah, every fruit or any fruit will help you, especially citrus, apples, stuff that are not rich in sugars. Because also, if somebody is at risk of having high cholesterol, they might be at risk of developing diabetes. So things that are high on sugars, like watermelon or mangoes, those probably will help you, but it's better if you use some of the less sugar-rich fruits. What that does, it's also preventing the body from absorbing all the lipids or the fat in the bowel, in the gut, and your body will be able to eliminate it. Also, with the amount of fiber that fruits provide to the body, will also prevent that absorption. So that's why it's important for that increase in fruits and veggies.
Okay, well, that ends our Q&A session. Dr. Uribe, thank you so much for taking the time this afternoon to be with us and to be able to interact with our Hidalgo County employees. As I mentioned earlier in the presentation, this is the first presentation that we do with Rio Grande Hospital, so I'm really excited that you were able to join us.
Thank you, everyone. I hope the presentation it's useful.
Thank you so much. Thank you, everybody, for joining us. We do appreciate your engagement in this presentation. Please stay safe and healthy, and I hope to see you in the next presentations. Thank you, everybody.